Namaskar, I'm Dr. Ramdeep Rai. I'm the head of the Division of Liver Transplant and Hepatopancreatobiliary Surgery at the Institute of Gastrosciences and Liver Transplantation at Apollo Multi-Speciality Hospitals, Kolkata. Thousands of patients across the country are suffering from liver diseases, be that liver cirrhosis or acute liver failure, and very often they reach a stage where the only form of cure, the only hope is liver transplantation. Liver transplantation is a modality for which India has become a global hub. Patients from at least 25 to 30 different countries across the world regularly come to India for liver transplantation. Liver transplantation may be in the form of living donor or living related liver transplantation or deceased or dead donor liver transplantation. In living donor liver transplantation, a family member, maybe husband, wife, father, mother, son, daughter, or a very close relative like a first cousin, comes forward and donates a part of the liver to his or her relative who is suffering from liver disease. The liver, even if 60 to 70% of the liver is donated, the remaining 30 to 40% grows back to almost normal size within a few weeks, making liver transplantation in living donors a very safe and reasonable form of treatment for liver diseases. India is quite the hub for living donor liver transplantation. For deceased or dead donor liver transplantations, we are having such organ donations and transplants across the country, but in very few numbers, whereas the number of organ failure patients are very high. People who have suffered road traffic accidents, head injuries leading to bleed, or a stroke leading to bleed inside the brain may progress to brain death and be in an ICU on a ventilator but completely brain dead. In such a situation where the heart is still beating, the liver, the kidneys, the lungs are still getting blood and they are healthy. So if the family members come forward and donate the organs of the next of kin, because they need to understand that these organs are going to be of no use being buried or burnt along with the dead near relative. So please think about organ donation. If the numbers of organ donations increases across the country, then the number of living donors who have to go forward for this surgery will come down, and many people can benefit from deceased donor liver transplantation, or other organs like kidney transplants, heart transplants, lung transplants can really increase and many people can benefit. India now has liver transplant programs in all the major cities. In East India and Northeast India, Kolkata has become the hub for liver transplantation, and the number of liver transplants are increasing. But there needs to be awareness. There needs to be the understanding that liver disease, liver failure can be cured with a liver transplant. There is no point suffering by repeated admissions for bleed, for jaundice, for water in your tummy, which is called ascites. There's no point continuing with the suffering, and therefore this is a form of treatment which should be availed of by more people. And with organ transplantation, we can influence the lives, cure and save the lives of many patients now.
This is Dr. Mahesh Goenka, Director of Gastroenterology at Apollo Multi-Speciality Hospital, Kolkata. Today, we are going to talk about liver disease and liver transplant. Liver disease constitutes a large volume of disease in our country. As an estimate, about 5% of the population is suffering from hepatitis B or hepatitis C. About 10 to 20% of the population is suffering from fatty liver disease. In addition, we have disease because of alcohol, drugs, and certain metabolic disorders. Liver disease can take form of either an acute liver disease, such as acute hepatitis, or a chronic liver disease, also known as cirrhosis. While a majority of these can be controlled and cured by medical treatment itself, a small and significant proportion do not respond to usual medical treatment and require liver transplantation. Though The number of liver transplantation happening in our country is increasing over the last few years, yet we are not there. For each liver transplant which we are doing, there are almost 100 patients who are not being transplanted in spite of the requirement. As you all know, the liver transplantation can be from a diseased liver, that means a dead person whose liver can be taken out after the brain death, or it can be from a life-related donor from where we take out a part of the liver and transplant it to the person requiring the liver. In our country, 90% of the transplants of liver are life-related and only about 10% are from the cadaver. For any program of liver transplant to succeed, we need to have more cadaver liver transplantation and less of life-related transplant. And for this, initiation from the patient's relatives who unfortunately lose their patients because of diseases like brain hemorrhage, roadside accident, it is required that they come forward and allow us to take the liver from their near and dear ones and to transplant it to those whose life can be saved by transplantation of the liver. It is my appeal for the public to come forward and to participate in this very noble cause of transplantation of liver, which can save a lot of lives of our patients.